You're listening to Co-Parenting with Grace, the podcast for families raising kids across two homes. I'm your host, Jody Grace, wife, bonus mom, professional peacekeeper, and your teammate in this beautiful work of co-parenting. So put that red lipstick on, Grace family, and let's get into it. Welcome back, everybody. Today is episode 3 of Co-Parenting with Grace, and I am so excited to bring to you my first guest interview. This guy was a no-brainer for me. He is someone I am truly honored to share with you, not just because of his professional expertise, but because of the role he's played in my own family story. Dr. Chandy is a child and adolescent psychiatrist currently practicing with Mosaic Life Care here in Missouri. His training spans the globe from U.S. to India, with residencies completed at Albert Einstein Medical Center and Thomas Jefferson University Hospital in Philadelphia. He holds academic positions at both the University of Missouri School of Medicine and UMKC. He's presented at national conferences as a passionate advocate for mental health and community outreach. But beyond all of that, what really stands out is how he blends clinical excellence with a truly holistic, child-centered approach. And I speak from experience when I say that. He doesn't just see symptoms, he sees the whole person. Dr. Chandy is also a man of many interests. He loves gadgets, dog training, cultivating his bonsai trees, to exploring the intersections of psychology, religion, and business. And did I mention he's fluent in several languages? He can do it all. He's just one of the most grounded, thoughtful people I've ever had the privilege of learning from. So today, we are pulling back the curtain on what it really means to support one child who lives in two homes, and how we, as the adults in their world, can do better. Well, Dr. Chandy, thank you so much for being here. I am so excited that we are finally sitting down and doing this.
Yeah.
So let's start with some simple things. Tell us a little bit about yourself and the work you do with families.
Sure. So thank you for having me.
Of course.
My name is Chandy. I'm a child and adolescent psychiatrist. I work with children, adolescents, and their families to address a wide range of mental health challenges. So the simple way I tell kids who are in the office is that I'm a doctor who tries and helps you reach your full potential by helping you with any mental health challenges you may have. And for that, if you tell me what you need help with, I can help you with those things. And if you don't tell me, then I cannot help you with those things. So I work with kids with anxiety and mood disorders to ADHD and behavioral issues. So my work typically involves comprehensive assessments and medical management when appropriate, and collaborating with families, schools, and therapists to develop a holistic treatment plan that supports a child's overall well-being.
Absolutely. Well, I can definitely tell that this is your calling. The way you handle our son, us as parents, it absolutely speaks to your passion. So was there something specific that drew you to child psychiatry, like a personal impact story or experience? What was it for you?
Well, to be perfectly honest, I did not know anything about child psychiatry until I came into psychiatry. And then even while I was training to be a psychiatrist, I originally thought that I would work as an addictions psychiatrist. But I got a chance to work on the inpatient child unit, and some of my experiences on that unit kind of drove me to then pursue this as a full-time calling of sorts.
Absolutely.
Yeah. And we can talk about certain cases, but it was totally something I just chanced upon. But
Yeah.
the more and more I got into it, the more and more I was convinced that this was a great choice.
Absolutely. So it kind of fell into your lap. And it's
Yes.
just, well, you've absolutely run with it. Like I said, the way you work with our family has been wonderful. And, it's something that I knew when I sat down and decided to do this. You were the first person that came to mind. I said, I have to sit down with Dr. Chandy. He can absolutely speak to how co-parenting plays hand in hand with a child's well-being, a child's mental health, and what we can do for them by bettering ourselves. So when a child is given a diagnosis like ADHD, oppositional defiance disorder, anxiety, mood disorders, as you mentioned, what do you notice happening in the family system?
Well, formal diagnosis, it can bring a mix of emotions and reactions from a family system. Often, there's a sense of relief as it can validate what the parents and caregivers have observed and struggling with, providing some sort of framework for understanding. However, it can also bring feelings of fear, confusion, shame, guilt, or even disagreement among family members about the diagnosis itself or the best path forward. Communication patterns can shift, and existing family dynamics may be amplified. It definitely is a critical time for families to come together, educate themselves, and seek professional guidance to adjust and support their child effectively.
Yeah, absolutely. It's so necessary. You speak to the relief that it can bring for a family, and I can absolutely speak to that because when you have a child that has big emotions, acts out, or struggles with behavioral issues, it's easy as the parent to say, what have I done to cause this? Or what am I not giving them that they need? Or why is this so hard? So, do you think this is something that children are born with? Or is this something that you think maybe their environment can create?
Well, definitely there is a genetic component to a lot of these conditions. But at the same time, there is also an environmental component to it, and even conditions as deadly as uh, I shouldn't say deadly, but as morbid as schizophrenia have
Mm-hmm.
a genetic basis to it. But then, if the environment and the treatment is available, people can live quite normal lives sometimes.
Right, right. Yeah, definitely. The environment is going to either hinder or help, no doubt. Well, I'm sure that you see it all. You've seen our co parenting trifecta come to appointments together, myself, my husband, and our boy's mom. Does it surprise you when you see step parents involved like this or even allowed to be involved? What are your thoughts on that dynamic? And is this something you see often or recommend it?
Well, to be frank, um, when I did see you at the appointment, I was frankly not surprised. And to be frank, I'm quite impressed because usually when anyone goes to the doctor, there's just one parent who goes with the patient. But in my particular specialty in psychiatry, and especially in child psychiatry, I feel it is um, always better if the father and the mother are present at least the initial appointment. So when I saw you there, I was like, oh, this is great, we have another person. And the thing, or the way I explain it to children during the appointment, is that imagine that we are a team, and everyone on the team is there to help one person, and that is you. And so your dad is here, your mom is here, Dr. C is here, we have your teacher or your teachers, and we also may have your therapist. We are all on the same team, and we are all here to support you in what you need. So, if you need something, reach out to either any of your team members. And also remember, because we are a team, we cannot fight with each other. So I
Right.
do not want you to be fighting with any of your team members, and your team members don't need to be fighting among themselves. If there's anything, we can talk these things out and we can sort it out. And this is the way that I tell them. So when I have a child, the more support that child has, in my view of things, that gives that child a better prognosis, because the more support you have, the better your outcomes usually are.
Absolutely. It's like there's enough love to go around, right? You can never love a kid too much. It can never come from too many places. And I'm very fortunate as a stepmom or a bonus mom that my husband is supportive of my relationship with the boy's mom, and the boy's mom is supportive of my being involved and being there. My husband works a job that he can't always take off and be at these appointments. And so I always felt it was important that someone from both homes are present, because in our case, we have 50-50 custody. I know that's not the case with all, but if the child is spending time in two different homes, in order for the doctor to get big picture, you need to know what's going on at both homes. And one mom reports, he's not eating well, he's doing this, and one might report, well, actually this week he's not slept so well. Oh, well, at my house he has. So, two different homes, two different things are happening. The child is reacting in two different ways. And if you can't see that, then how can you, properly treat, the patient? And so that was always important to me. I asked to be involved, and I'm very thankful that in our relationship that is supported and welcomed. So a part of the reason I wanted to share this podcast with people and explain that it doesn't have to be hard all the time, that it starts with the parents. It's like you said, the team cannot be fighting amongst each other. The little people are watching, and we are here for them. We are here to set them up for success. So, through our journey, you have spoken with us about the importance of being firm, unemotional, and consistent. And in a co-parenting situation, especially across two homes, what does that actually look like in practice? And why is it so important for a child with a diagnosis?
Yes, absolutely. Being firm and to a certain level unemotional and consistent in co-parenting, especially across two homes, means establishing a shared understanding of rules, expectations, and consequences, and then applying them predictably, regardless of which parent or home the child is with. In practice, this often involves parents communicating regularly and collaborating on a unified parenting plan. This plan might detail routines, behavior expectations, disciplinary approaches, and even how consequences are delivered. Unemotional doesn't mean uncaring. It means responding to behaviors with a calm, deliberate approach rather than reacting out of frustration and anger, which can escalate situations. For a child with a diagnosis, this consistency is paramount. Many diagnoses such as ADHD, anxiety, or ODD involve challenges with self-regulation, emotion processing, or impulse control. A consistent and predictable environment provides external structure that helps a child learn internal regulation. Inconsistency, on the other hand, can be incredibly destabilizing. It creates confusion, uncertainty, and can unknowingly reinforce maladaptive behaviors as the child learns to test boundaries or exploit differing rules between homes. Consistency helps build a sense of safety, security, predictability, and allows the child to generalize learned skills across different environments, which is crucial for their progress and behavioral health.
Absolutely. You know, and I mean, as adults, it's hard enough to stay regulated when we get angry with each other.
Yeah.
You know, I can imagine that as a child, you have no idea what these big feelings are about, what they're for. And then you have a parent yelling at you, stop crying. What are you doing? It can create all kinds of confusion and lasting trauma that carries into adulthood. And then here we are showing up at therapy appointments as adults, right? So, you know, I mean, with that, let's talk about some common mistakes, you know, that you see parents, co-parents make when trying to support a diagnosed child.
Yes, sure. So one of the most common mistakes is a lack of consistent communication and alignment on the treatment plan and household rules. This often leads to conflicting messages for the child. Another frequent mistake is inadvertently parentifying the child by putting them in the middle of parental disagreements or asking them to relay information between homes. Parents can also make the mistake of not fully understanding or accepting the diagnosis, which can lead to resistance to treatment recommendations or a belief that the child is choosing certain behaviors. Also, some parents will be over accommodating or under challenging the child due to the diagnosis. This is also a pitfall, as it can stop their development of coping skills. And finally, neglecting their own emotional well-being and not seeking support for themselves as co-parents can lead to burnout and impact their ability to effectively parent.
Absolutely. You know, I am a firm believer in therapy and working on yourself first. You mentioned parentifying. You know, that's something that a lot of adults deal with and don't even realize it. Can you talk to me a little bit more about that, what parentifying might look like?
Right. So one easy or simple way to think about this is, imagine that you have a child. A child goes through certain developmental stages and experiences to become an adult. What parentifying does is, in effect, it kind of fast forwards this child through these stages, and then the child never gets to be a child. The child becomes an adult in certain ways in which they respond to their environment, and this, although may seem like a great thing because everybody wants to be more mature, but when a child is not allowed to be a child and child has to quote unquote grow up too fast, it has lifelong impacts on their future relationships and ways in which they approach issues. So it is always important that children do not end up in situations where they become over parentified.
Yeah. So that's an episode all itself.
Yeah.
We could talk about that for an hour for sure. So I'm going to earmark that, and maybe we can circle back to that on another episode, because I definitely think there's a lot to unpack there. But you had also mentioned under challenging a child being a mistake that parents can make, and I know this is something I have to work on, not being a hover mother, trying to do everything for them, for both of my kids, letting them have more autonomy and figuring things out for themselves. I know that's key to building their independence and being a self-thinker, but it is so hard as a parent not to want to do it for them or tell them how to do it to prevent them from making mistakes and learning the hard way. when in fact that's probably exactly what they need to do.
Absolutely. Yes. Yes.
So, these common parental mistakes or missteps, what impact do these have on the child's behavior, progress or behavior, when you have one household that isn't aligned with the treatment plan or the household structure?
Yes, absolutely. So when such situations happen, and trust me, it is more common than not, and most of the time they are not aligned. So when one parent isn't aligned, it can significantly uh, you know set back the child's progress and make behavioral challenges worse. Inconsistency creates confusion and insecurity for the child, making it difficult for them to internalize and generalize new skills and expected behaviors. For example, if in one home the rules are very lax and you can do whatever you like, and the other home is trying their best to help this child or create better structure for this child, when the child goes from one home to the other home, there's always going to be a period of readjustment, and during this period of readjustment you will notice that the child starts to act out, and the parents, although they seem to be doing everything right, end up seeing unexpectedly emotional or children with behavioral issues, even though they are doing everything right. So this is a big problem when we are trying to help a child, making sure that both parents are on the same page in terms of treatment plans. From a behavioral perspective, children are incredibly good at identifying these inconsistencies between the homes and between the parenting practices of the parents. If one home is permissive, a child might learn to exhibit challenging behaviors because consequences are minimal, or conversely they might act out in the structured home. When they come back to the structured home, they start acting out there due to pent-up frustration from the very lax or permissive environment. This lack of alignment can undermine the treatment that we are trying to give this child and reduce the effectiveness of the medications, and then sometimes we end up with kids being on more medicine than they require, all because we could not set the foundation of this treatment, which is having consistent treatment for the child across the two homes. So this will ultimately slow down, or even in some cases reverse the positive changes that we sometimes see when treatment is started.
It's so avoidable, like what you mentioned there. It's we as parents need to check our traumas and our insecurities and our angers and our fears. That stuff needs to be checked at the door, because this is what we're doing. What we are doing is having a profound effect on their ability to be their best self, right? Because we're just getting in their way. So what would you say to the parents that are like, my house, my rules, or we do things this way at my house, they can do things this way at their house? What would you say to those parents, or the ones that make decisions that affect their kids just despite their ex? How do those parents set their differences aside for the child's well-being?
Yes. And this is a big part of what I kind of try and help not just the child but both families with. So from the beginning, when they first come to me, I always explain to them that, let's say that on the first day we've come with just mom, I always explain, okay, next appointment, why don't you also get dad? Or if dad wants to come for a separate appointment without anybody else, I will even try and accommodate that. Because sometimes when when someone has a question and they do not want to ask these questions because it would show some sort of insecurity on their part, they will not, if there is anybody else in the appointment, they will not even ask the question, and then after going home they'll be like, no, I'm not doing this. Whereas if I have a parent who has some questions of the sort, it is always important. I always tell everybody, anybody who has questions can contact me in between appointments, send me a message, call and talk to the nurses, leave a message. I will call them back, or I will address their concern. And if they need an actual appointment to discuss this, I'm open to that. Because making these adjustments and clearly laying what I will and can do for this family is important in building that therapeutic alliance. And once that alliance is built and there is trust, then treatment is much more easier and more effective.
It's so important.
Yes.
Yeah, building that trust is so important. Now let's talk about the medication. You mentioned that because that's often a heated topic in co-parenting. I know in our situation, my husband and I had a hard time when it was first brought up as something that our son might benefit from. And there's often hesitation, especially depending on the child's age. What do you wish parents knew when it comes to starting and stopping medication, especially when there's a lack of mutual agreement or belief in that treatment plan?
Absolutely. This is a vital part of the treatment. So what I explain to everybody is that in psychiatry, whenever, we are trying to come up with a treatment plan for anybody, an adult or a child, we have to explain that there are two broad ways in which this treatment can proceed. One is the behavioral approaches that we can use and the conversation or the talk therapy. The other is medications. And what I would say is that sometimes for some conditions, just doing the talk therapy or just teaching the child the skills required might be enough. In some situations, in addition to the talk therapy, unless we add some medications, the child may not be able to, in some sense, be calm enough to listen to the talk therapy or engage in the talk therapy and learn the skill that the therapist is attempting to transfer to the child. So talk therapy has its place and its benefits. Medications has its place and its benefits. Sometimes one will work, sometimes we need both. Therefore, it is always important to explain this from the start. And then I believe in meeting people where they are. Therefore, if the parent has any objection to the medications, then that is where we're at, and that is where we have to start. And we can start the behavioral interventions and continue to discuss about the medications. And if the parent has some concerns, all I can do is address those concerns to the best of my ability and to the satisfaction of the parent. And I also like the parents, during the sessions, I do explain to the parents that this is like a team effort. So it's not like I'm going to decide the medication without, discussing it with the parent. I will come up with the best recommendations based on the available evidence, and then the parents can make a choice on these medications. Parents should also understand one of the guiding principles of child and adolescent psychiatry is uh, go slow and start low. So it's like we always start the medications at the lowest possible dose, and we slowly increase the medications depending on the um, improvement in the symptoms that we are trying to treat. um, there are many books that have been written on this matter, and all the books agree that as far as child and adolescent especially is concerned, this is the way to go, and this is the one that has shown the best results. So we don't really need to be starting at high doses and do everything in a fast and furious way too, because we are not out for a quick fix. And if they are out for a quick fix, then Dr. C is not maybe their best problem, because we are working with children. We need to clearly do things in a safe and evidence-based way, and that cannot be done in a very fast way. Also, let's say that we have started some medication. There are some medications which you can just stop, but most of the medications should never be suddenly stopped without checking with the doctor who has written this medication, because there are medications, and even for children, I do very regularly write some medications that could have an effect on the blood pressure, or can have an effect on the distress tolerance, or on the reactivity that children have. So if you suddenly stop these medications, they will have some sort of withdrawal symptoms, which can make life miserable for that child, and definitely for the family. So in situations where there is no mutual agreement, it is a very challenging situation to treat this child.
Right.
Because if we are getting the medications in one home and then we're going to the other home and not getting the medications, this is very harmful for the child. And as someone who wants to practice ethically, it is not reasonable for me to kind of play this sort of risky treatment. So I never agree to start treatment unless both households are on the same page with respect to medications.
Right. You don't want to run the risk of them getting it half the time and then not getting it the other half.
Right.
And that's dangerous.
Yes.
We as adults don't do that.
Right.
So
yeah. And ideally, parents should engage in an open dialogue and communication, and if they want a second opinion, they should get that. In the end, it should be about the best interest of the child. And personal disagreements might still be there, but everybody needs to see what is in the best interest of the child, and then go with that. Now, if agreement cannot be reached, the parent with a medical decision making authority, often defined in the parenting plan or the court order, typically has the final say. But again, even though legally this is the situation, psychiatry and psychology is a very different field. Even like they say, 80% of communication is non-verbal. So even if on this surface legally you have the right to go ahead with this treatment, I always caution against it, and I try to get everybody on board, because even the nonverbal communication from one parent who disagrees with this plan might, prevent this child from getting the best possible treatment when it comes to, even when it comes to medications.
Right. And we're not talking about allergy medicine.
Yeah, exactly.
What we've seen with our son is a total boost in confidence. It's not perfect at first starting new medication. There was an adjustment period, and with parents, we have to work closely with the provider to make sure the dosage is right. Like you said, what you might first, prescribe, we might have to change, or, over time that doesn't work now and we have to do something a little different. But it can take a child from, I hate school, I don't want to go to school, to I love school. When do I get to go back? It can take a child from, I don't have any friends, to, let me tell you about my friends I played with today. And that is worth it. That's what makes it worth it. We're doing this for the child. And it's okay as a parent to be scared, to question. I think it's healthy to question. But you also have to listen, and you have to set your own frustrations aside, and what you might feel towards the other parent, and especially if they're the one who's leading this charge and believing that this is what's necessary, not look through that lens of, well, you're just wanting to do this because we have to look at what's best for the child. So when it comes to navigating tough conversations with kids, the hard conversations about their diagnosis, or honestly any tough topic we have to teach our children about, how do you suggest parents navigate that when one home or parent is more open and the other might be more avoidant?
Helping the child have an understanding of their diagnosis is a big part of treatment success. Navigating these conversations about this diagnosis requires sensitivity and age appropriateness. Some things are better explained in age appropriate way to the child, in such a way that they are not scared, or they do not feel like they are less than, so that the child is empowered with this understanding and not scared or feeling like there's something wrong with them. Now, when one home is more open and the other one is kind of avoidant, this is a significant challenge. Ideally, parents would agree on a unified message, even if it is very basic. If that is not possible, the parent who is more open to this can continue to provide developmentally appropriate information in their home, focusing on how the diagnosis can explain certain symptoms and challenges, and how these strategies that have been recommended can help. It is crucial not to badmouth the other parent's approach. Instead, frame it in a way that respects different communication styles, perhaps by saying, different adults have different ways of talking about these things, but what's most important is that we all want to help you feel your best and achieve your full potential. The child should never feel caught in the middle. Focus on explaining symptoms and coping mechanisms rather than dwelling on the label itself, and reassure the child that the diagnosis is not their fault, and whatever it is, that they are loved and supported.
Yeah, absolutely. You make such a good point. You have no direct control over what's happening or being said in the other home. So, be the example in yours. Kids are smart. They gravitate to discipline and consistency. So focusing on giving them what they need in your home, and they will be stronger to handle what's happening in the other if it's not as cohesive. So I'm sure that, in your role, as you've said, you see all different parenting styles in your practice. Say one is structured and the other is more permissive. How does that affect, a child's mental health journey? I know we've talked about that a little bit, but
Right. So different parenting styles are common, but when they become significantly divergent, when they are different, especially with a diagnosed child, it can create what we call sometimes a schizophrenic environment for the child, meaning one that is confusing and inconsistent. A structured environment provides predictability and clear boundaries, which can be immensely beneficial for children with diagnoses like ADHD or anxiety. A permissive environment, while seeming less stressful in the short term, can lead to lack of limits, inconsistent consequences, and ultimately a child who struggles with self-regulation, impulse control, and understanding social expectations. Now, the impact on a child's mental health can be significant, like reduced progress in therapy, increased behavioral outbursts, heightened anxiety due to unpredictability, and difficulty developing coping skills. The child may also learn to manipulate the differing styles, playing one parent against the other, which can strain the parent-child relationships and the parental co-parenting dynamics. So ultimately, finding common ground and striving for sufficient consistency across homes, even if styles aren't identical, is very, very important.
yeah. So talk to me about that sufficient consistency across two homes. What does sufficient consistency look like? What's the minimum we can strive for?
So there are different things for which this can be applied, but one thing can be like whatever it is, medications need to be taken every day. Kids need to go to bed at a certain time every day. So it's like you could, in one home, if it is 8 o'clock in the evening, maybe in the other home it might be 8:30 or at most 9 o'clock. If it is more inconsistent, like if it is more than that, in one home it is 8 o'clock, the other home it is like 11:30, 12 o'clock, that is inconsistent.
Right.
So as far as possible, be as close as possible to the other home. If that is possible, be as close as possible. That
Right.
is ideal.
For this,
But we do not live in an ideal world.
right.
So
right.
whatever
Right.
works best is what at least something better than nothing is what I say.
And it just like you say, focusing on those basic necessities, the simple ones that, if you want to dig your heels in and say, we're eating pizza for dinner every night, whatever, but bedtime, let's agree that we're going to shoot for the same bedtime. Let's agree that this medication is being taken at the same time every day. I know that's important too. So we'll shift directions a little bit here. We've talked a lot about what we shouldn't do. So tell me, or can you share a story with us or situation, even if hypothetical, where you saw a co-parenting team really get it right? What does that look like?
Right, absolutely, yes. Well, give you a hypothetical example. Imagine a family where a child with ADHD was struggling significantly with schoolwork and emotional regulation. The parents, who were divorced initially, had very different ideas about how to manage things. However, they committed to regular, business-like communication, often through some sort of online portal or email system, to discuss the child's progress, challenges, and the treatment plan. Some of the things that they did really well are: number one, prioritizing the child's needs. They consistently put their child's well-being above their own, past their disagreements or emotional baggage. Number two, united front. They agreed to be consistent. they agreed to having consistent routines for homework, bedtime, and consequences for misbehavior, applying them across both homes. If a consequence was given in one home, it carried over to the other. It's not like you're gonna go back to the other home in 2 days, so your consequence, which should have lasted 5 days, is now only 2 days. No, you have 2 days here, and then you go to the other home and you complete the other 3 days in the other home. The third one is being open to professional guidance. Both these parents actively participated in the therapy sessions, listened to the recommendations from the psychiatrist and the therapist, and were willing to adjust their approaches based on the professional recommendations. The fourth thing that they did really well was respectful communication. Even when they disagreed, they maintained a respectful tone, focusing on solutions rather than blame. They used I statements and concentrated on logistical matters related to the child's care. And the fifth thing that I could say is flexibility. They were willing to be flexible when needed, understanding that life happens, but always returning to their core principles of consistency and collaboration. For example, if I agree to something, I may not be able to hit the target 100% of the time. That doesn't mean that I have to say I'm a failure and, say that this treatment plan is a failure. There may be mistakes. Be flexible with that and go on to the, think about the bigger picture. Once these things, prioritizing the child's needs, showing a united front, and listening to the professional recommendations, respectfully communicating with each other, and being flexible in your stance. Once these things fall into place, the child starts to feel more secure, understands the expectations, and this child made remarkable progress both in school and with respect to emotional outbursts in the home. This coordinated effort significantly reduced the child's anxiety and allowed this child to thrive.
Yeah, absolutely. And, if we have a listener who's thinking, our homes feel so different, how do I even begin, to make things more consistent? Especially when I have no control over the other home's rules or decisions, where do they start? I know we touched on that, but what are some routines, some basic things other than the ones we've mentioned? Where can they start?
Sure. Like all negotiations, try to build common ground. So if both the homes are very different, the first step is to identify one or two key areas in which it is inconsistent and causing the greatest distress for the child. Okay, you may not be able to change everything in one shot, but identify one or two things that you feel is very important and start working on those. Then start with concrete, observable routines. So that is where I always say structure in the home comes with routines. So try to start with that. The other thing that everybody does is everybody has to sleep. So aim for similar bedtimes and wake up times, even if slightly adjusted on the weekends. Ideally, it would be best if you could be as close as possible, but aim for similar bedtimes and wake up times. The other thing is schoolwork, homework that they bring from school. Routine. Establish a consistent time and place for homework. Sometimes some of the medications wear off towards the evening. In such situations, to optimize the medications and help the child finish any homework that is brought home, it is it is important to do it as soon as they get back after taking a very small break. So keeping that consistent routine of doing homework as soon as they come back is maybe something that everybody can get on board about. The other thing is basic rules, like agree on a few basic behavioral rules that are non-negotiable in both homes. For example, no hitting, safe hands, respectful language. These are some practical things that everybody can start with. Beyond that, of course, open communication, even if it is difficult, is essential. For that, sometimes it is better to do it in a modality like text, for example, because it takes out a little bit of that emotion out of the message, and people are more likely to consider the content rather than the tone of what is being said. And consider using something like a shared notebook or a shared calendar, and make it short, make it brief, and exchange information at least once a week. Make sure that everyone is aware of the child's achievements and aware of the challenges that the child is having. Now, if direct communication is very conflict prone, then a neutral third party like your therapist or counselor can be the one to facilitate these conversations.
Absolutely. That's being able to have these conversations is important. So if you can't, reaching out to somebody who can mediate that is key for keeping your children on task and in what they need to feel is a safe environment. So we've talked about simple universal routines. We've talked about sleep schedules. Talk to me a little bit about screen time rules. Let's talk about that. I know that's something that we have talked about. How much should they get? How little should they? What is your take on something like that?
Right. So this is actually the topic of my Grand Rounds presentation. So I could go on talking about this for long. But generally speaking, the recommendation is that if you have a child who is who is not going to school, that child needs to have the most minimal screen time. What the societies or the associations, the pediatric associations, what they recommend is 1 hour at most for those who are not of school going age. And once you are of school going age, the recommendation is to not go beyond 2 hours. And once you are maybe in high school, that could be to max 3 hours per day. But again, nothing is set in stone. There may be one child who is spending 1 hour drawing something or doing a creative activity, whereas another child is spending that time just watching a movie and not being creative in any way and not interacting in any way. So all screen time is not the same. So that is another important thing to think about. But as a general measure, the max is 3 hours, and if it's a child who's not going to school, it should not be more than an hour, if you ask me.
Yeah. Okay. I agree with that. So with screen time, could that overstimulation, affect a child with a diagnosis more? Or if we have a child that doesn't have a diagnosis, could too much screen time create that? And especially children like elementary school children that are still developing.
Absolutely, absolutely. And this is something that, I have seen time and time again. Um, there was actually a parent who, after an appointment with me, and I say this to all parents, she went home and she started uh, this. She went home and she did something in the home, and then she came back, and what she tells me is, hey, Dr. C, I really took to heart what you said about the screen time with my kids at home. So I went home and I explained to everybody that we are going to do this thing where we're not going to have screen time for the next 4 weeks. And it was really hard initially. Everybody was complaining, and we stuck with that. And she came back and told me, Dr. C, now I feel I have a new family.
Yeah.
The behaviors that I was seeing earlier, they've all gone. Even my husband and me, we feel a lot more energetic, and we feel a lot more relaxed when this excessive screen time is gone now.
Right.
So it is a really big deal to, when you have a child who has a diagnosis, or the child does not have a diagnosis, if you have behavioral issues, then excessive screen time is one of the key culprits. Because in addition to spending time which is practically a bright light shining in your eye, there is the content that is being consumed that then goes in and is subconsciously working on the mind. And what the child sees sometimes comes out in various ways.
Absolutely. Yeah. So that applies to adults too. Like we're staring at computers all day long, and then we come home and we're looking at our phones, and you heard him, ladies. You got to turn off your Love Island. It's time to put it down. Walk away from it. Your kids are watching. Oh, I think that's a fabulous idea. Trying to implement, even if it's not, totally screen free, but when you come home in the evenings, setting your phone down, put it on Do Not Disturb, and, get outside in the backyard, or sit down and play a game. I have a friend, and they play Uno with their kids every single night after dinner. They sit down at the table, they eat dinner together, and then they play a game of Uno before they go to bed. And I love that. I love that. You're bonding with your kids, you're bonding with your partner. It's just, you're setting an example of, because there's a 50-50 chance, if not greater these days, that your children are going to live in a blended home, in a blended family one day. So let's really focus on setting positive examples and showing them what that can look like. And, hey, we sit down and play this at Dad's. Mom, can we play this here? And, trying to carry that over. You teach your kids, and they're going to come home and set examples for you. They're going to show you how to lead the way. So setting them up for success, but no doubt working closely with schools, therapists, as you mentioned, and, even extended family, that play a role in a child's life, that can play a huge role in reinforcing the treatment plan. So what role can this part of the team of people play when the co-parents aren't always on the same page?
Absolutely. And circling back to my earlier analogy, every person on this list is part of a team, and this team is all interested in helping this child succeed and reach their full potential. So in that sense, the schools, the teachers, the therapists, and the extended family can all play a vital role in supporting and reinforcing the child's treatment plan, especially when co-parents are not fully aligned. For example, the school can be crucial partners. With appropriate releases of information, schools can implement consistent academic accommodations and behavioral strategies needed for the treatment plan. Teachers can communicate observed behaviors and progress to both parents and the treatment team, because the child spends quite a big chunk of their day in the school. The therapists, the counselors can serve as a neutral party to help mediate communication between the co-parents, providing a space for them to discuss the treatment plan and its implementation. They can also educate parents on the importance of consistency and help them to develop shared strategies. And extended family like grandparents, aunts, uncles who regularly care for the child can be educated about the treatment plan and encouraged to uphold agreed upon routines and expectations. They can be invaluable allies in providing a consistent and supportive environment, reinforcing positive behaviors and modeling appropriate interactions with the child. It is essential that all these parties work collaboratively and avoid taking sides, always focusing on the child's best interest and the agreed upon treatment goals.
Absolutely. Yeah, I think if we've learned anything today, it's how important consistency is.
Mm-hmm.
And this is, specifically speaking about a child with a diagnosis, but all children. Consistency is so important. If you could offer one sentence of reassurance to a co-parent that's listening today, feeling defeated or out of sync, what would it be?
Well, what I would say is even small steps towards consistency and collaboration make a big difference in your child's well-being and progress.
Absolutely. That's so good. So wise. In addition to that, any last thoughts you have for our listeners today?
Yeah, well, for information about my work and services, we provide, you can visit Mosaic Life Care's website and look for our outpatient behavioral health services, for other trusted resources on supporting diagnosed children. I highly recommend organizations like CHADD and Attitude magazine for ADHD resources, and of course the American Academy of Child and Adolescent Psychiatrists, which has a section on facts for families. These organizations offer evidence-based information and support networks and practical strategies for families.
Great resources. We will link those in the show notes down below as well. So if you guys are looking and want to follow up on some of those things that Dr. C's mentioned, we will have them for you. But before we wrap today, I just want to leave you with this. At the end of the day, this isn't about us as parents. It is about our children. The children living in two homes, the little people who didn't ask for this setup any more than we did, even less so. We have to check our anger, our insecurities, our fears, because when we let those things lead the way, the child is the one who ends up carrying the weight. Our children are watching, they are listening, they are learning how to handle conflict and how to process emotions based on us. So if something feels off, if your child's behavior seems bigger than typical frustration or development, do not ignore that instinct. Seeking help from mental health professionals is not weakness, it's wise. And the same goes for you, because here's the truth. You cannot pour from an empty cup. Prioritize your own healing, your own mental health. Not just for your co-parenting relationship, for yourself, but most importantly, for the little one watching your every word and move. There is always room to show up with more grace. And I'll remind you again, you are doing better than you think. I am Jody Grace, and thank you for listening to Co-Parenting with Grace.